Hi, before we start this ASMR video, I'd like to thank all these members on my Patreon for their continued support. If you're looking for any content that I create on other platforms, check the link below. Now, let's get into the video. Hey, so glad that you came in for your cranial nerve exam today. I hope you're ready for it. We're doing our quarterly checkup to make sure that everything's firing properly in your brain, right? Good. So, I've actually got a couple new tests that I'd like to do on you, as well as those cranial nerve exams. We'll go through about 10 to 12 processes, making sure that everything is, correct in your face, your eyes, your ears, your reflexes. You know the jam. Good. Alright, so, like always, I start with a little bit of an eye exam. So could you please look up for me? Thank you. Great. Just having a gander at the eyes there. Just gonna pull your eyebrow up there. Great. And then the other eye, just having a look. Good. And then looking down for me, please. Just gonna pull that eyelid down right there. Great. Just good. Looking down on the other eyelid. That's great. Just don't. Okay, now look right at me, please. Try not to blink. Do not blink. Don't blink. Good. Was that hard to follow at all? I noticed your eyes got a little bit fuzzy there. Great. I'm just going to do both eyes at the same time, and I'd like for you to just be as normal as you can. Just sort of look past me. Look past me. Good. Alright, here we go. Okay. Now I'd like you to tell me which light is brighter. Just have a quick look. Which light is brighter? I don't want to blind you. Good. Great. Okay, so eyes so far. Pupils equal and reactive. That's what I thought would happen, which is obviously a good thing. You want your eyes to be working properly. I'm just going to ask you to follow the light when the pen light when I come in from each corner, okay? Just follow along. No rhyme or reason, just want to see. Just follow along. Good, keep following. Was that hard at all? Was either eye having a tough time getting? Good. Now I'm just gonna come closer to you and then farther away with the light. You just tell me if it starts to become unbearable. I'm gonna shine it sort of past your eye. Just watching your pupils. So just look past the pen light for me. Just look past it. Look past it. Good. Look past it. Look past it. Great. Coming in from the side. Look past it. Look past it. And past. Good. Your eyes seem fantastic. A couple little tests here, and then I'll move on to the next one. I'm just going to cover this eye here. Great. Can you still see me? Excellente. This side. Still see me? Wonderful. I'm going to cover both eyes. Can you still see me? No? Good. Alright, we're just going to have there's a little bit of a mesh see-through here that you can see through, correct? Can you still see me? Just even like an outline of me. Can you see me moving some objects? You could? Great. Alright, now I'm just going to get you to cover one eye like this for me, please. Just cover that one eye for me. Good. Now, am I blurry or am I clear? Great. Other eye. Now, am I blurry or am I clear? Great. Your eyes are no problems there. You never seem to have issues with your eyes anyways. Last test here. Could you please tell me what color this is? What color is this? Great. And the color of this? What color is this? me pick. So kind of you. Thank you. I'll use the yellow one. Just gonna do a couple of measurements here, make sure that everything's symmetrical. You know, as we get older, our face does change a little bit, so just stay still for me, please. Alright. I like what I'm seeing. A little bit closer there. Okay. Yeah, alright. No issues there. Let's put that down. I don't need that around my neck. Alrighty, so just gonna make a couple notes, quick notes here. Any changes in your weight? Okay. Diet. Any other medications that you're taking that I'm not aware of? Okay. Bowel movements, still good. Great. Any discoloration in your pee? Great. That's what we want to hear. Any fluctuations in anxiety, depression, mood swings, anything out of the normal? Good. So just look at what you previously had in here. 16. No, sorry about that. Didn't mean to hit you there. Okay, alright. Great. A little bit of an ear test for me. Can you hear this noise? Good. What about this ear? And this ear? Good. Can you hear it above you? Can you hear that noise above your head? To the sides. You can hear all of that, correct? Good. Does it sound farther away? Now what about when I get close to your face? Does it get louder? Good. What about when we're side to side? Good. No issues there. Good. I'm just going to have a quick little gander at your ears there. Oh, you got your ear pierced. Quite nice. I like that. And this side here. Good. Your ears look great. Do you clean your ears? No. Good. You shouldn't. Q-tips weren't invented for that. It says it on the back of the box. Okay, ears fine. Hearing, no problem. Okay, I'm just gonna quick listen to your heart here. Let's warm this guy up. Good, just gonna listen to your heart. Your heart's beating a little bit quicker than it should be. Why is that? It's fair. You were looking at your doctor's bicep. Even doctors need to work out too. Duh. I hope you're working out as well. This is not about me. Let's get back to your heart. No, just calm yourself. Think about a chair or something. And go. Are you thinking about the chair? Good, let's try it now. I like what I'm hearing. Great. Your heart sounds normal. Now that it's not beating any quicker. Good, let's write that down. It's always good so I can refer to these notes in 3 months' time. Heart rate normal after coming down from seeing doctors' biceps. Note about patient. Enjoys seeing doctors' biceps. Always have to make note of that stuff. Alright, so now that we've done that, done of your cranial nerves there, I'm just going to be testing for cranial nerves like 6, 7, 8, 9, 10, 11, 12 through motions that I do for you. The first one's going to be, I'm going to get you to, what am I going to get you to do? I'm going to get you to push your, shoulders up. I'm going to be pushing down. So, shoulder, hands on either side. Now I'd like for you to push up when I say, okay, ready? And push, 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 push. Oh, good. Strong shoulders. Now, I'd like you to put your shoulders up for me like this. I'm going to push down. Okay, so shoulders up for me. Good, good. And up and push, 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 push. Strong shoulders. I like that. Next, I'm going to be doing your biceps. So I'd like for you to put your arm up. Put your arm up like this. Great. Just like that. Except facing me. Just like this, please. So arms up. I'm going to pull you away from me like this. Like pulling away. Then we'll do it the other way where I push you in like that. Okay. So arms out for me. And resist, 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 resist. Wow. I caught you staring at my biceps. None of that. Okay, I'm going to be pushing your arms in now. Okay, ready? And resist, 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 resist. Great job. Your strength is impeccable. You have been going to the gym, haven't you? You've been listening to your doctor's orders. That's good. That's what I want. At the end of the day, I want my patients to be healthy. Alright, so patient has extreme strength. You liked that word. Extreme strength in resisting and pulling both shoulders, biceps, in and out. Good. Alright, just a couple little examinations. I'm just going to get closer to you. I'm just going to feel around on your face a bit just to test out some areas. So I'm just going to when I go against this area, does that hurt? Good. What about this side? I'm on this side right here. Sorry, I'm not meaning to move your head as much. No? Good. Up here. And down here. Any of those spots hurt? Good. I've got a pen here. I'm going to prick you with the hard side, the sharp side, and then the dull side. You just let me know if this is pointy or not. Okay, ready? Okay, and here. And here. And here. Here. Good. And here. And here. And here. Alright, last one in the center here. Good, and here. Good, yeah, you passed all those. You could tell which side was the dull and the sharp side. That's good. So, other than that, I can do a quick little examination of your scalp here. Nothing really to worry about. I'm happy. I think you're in tip-top shape. Like always, I didn't really have any worries at all. You're my best patient. You never have problems, so that's always a good thing. Great. Just enough time for me to go have a bite to eat. Margaret will see you at the front door. No payment necessary, as always. Just a comment and a like. That's all she appreciates. I'll see you at our next quarterly 3-month interval for your next cranial nerve exam. So take care. I'm going to go have my delicious sandwich. Bye-bye. I see that you're back for your cranial nerve exam. I feel like I've done a cranial nerve exam to you like 100 times now. You must have quite the neurological problems if you're needing to come back this much. No problem though, I'm here for you. As a doctor, it's my obligation to treat you. So I'm sure that you're familiar with the sequence of events that we're going to go through, but regardless though, I will still go over them and let you know what I'll be doing, when I'll be doing it, where I'll be placing my hands, etc., etc. Do you have any questions before we begin? No? Alright. So, you know that there are 12 cranial nerves that I will be examining, and while I am doing that, if you have any questions or concerns, you just stop me at any point, and we'll go from there. How does that sound? Great. Let's get into it. The first thing that I'm going to need to look at is your eyes. You can see on the pen here, it shows you pupil dilation from obviously most dilated to having pinpoint pupils. When you're in an area that has light attached to it, letting light into your eyes like this, your pupils will shrink. That's because they don't need that much light in order to see. When it's dark, your pupils will dilate, trying to let in as much light as they can. This is to help you see. An example is nighttime. You turn off the lights, your eyes need a second to adjust. Focus, bring in some light. So, just look at me, please. Great. Does that hurt your eyes at all when I go in to out? Does that do anything to your eyes at all? Good. Next one. In and out, in and out, in and out. How did that feel? Any burning sensation in your eyeballs? No. Any discomfort of any type? Good. Alright, so I'm just going to go in and out quickly. I'm going to look at the dilation of your eyes just to see if they're equal and reactive. So just... Good, that eye is great. And... Excellent. Eyes are equal and reactive, so cranial nerve 1, good. I'm just going to follow the light. Please follow the pen light up, and then follow that pen light down, up, and down. Good. Next eye, follow the light up, and down, up, and down. Any difficulties with that? Good. Follow it cross diagonal, side to side, please. Excellent. Following it side to side. Any difficulties with that? Great. Every time that you come in, you always pass the eye exam with flying colors, and there never seems to be an issue. Are you sure there's not something wrong internally in your brain that's maybe telling you that you need to get a checkup on a neurological exam from a doctor like myself every so often? That's okay. That's alright. Okay. Light here. Can you please just tell me when I get it closer to you, does this become blurry? Or does it become focused? Blurry or focused? As I get closer, does it get focused or blurry? Good. As I pull away, does it get focused or blurry? As I go in, focused or blurry? As I come out, focused or blurry? Good. Yeah, I'm not sure what's going on with the lights here today in my office. They're making it seem like it's a consistent sunset here. No worries, though. It's always nice to feel like you're having a sunset in the area here. Alright, so you've seen these tools many times before. I'm just going to come close to your eyes here. Can you see me at all? At all? As I move this around. Great. Next eye. Can you see me at all as I move this around? Can you see me at all? Good. As I cover one eye, can you still see me in the other eye? As I cover the other eye, can you still see me in that other eye? Good. I'd like for you to cover your left eye for me, please. Good. When I cut with that covered, am I still blurry? Good. Cover your right eye. When I cover this eye, am I blurry or in focus when you have that eye covered? Great. No issues there. I would like to just get a little bit closer to your eyes now that I've examined them from a distance. I'd like to look back at the retina in the back of your mouth there, so just back of your mouth, back of your eyes. Please just look up for me. Thank you, thank you. Okay, that's great. Just look down for me, please. Just look down. just wanted to look at something. Now, can you look up for me? I'm just gonna pull your eyelids up just a bit here. Just need to see what I'm looking at here. Okay, now look down. Apologies, I had a frog in my throat. Didn't want to cough on you. Great. Now I'm just gonna measure we've done this many times before. I'm just gonna measure the distance between each one of your pupils. So just look directly at me. I'll just pick a number here. Good. And great. 24, 28, center, 26. Directly, yeah. Perfect, yeah. Great. 2 inches between the midline center of your nose. So your eyes are symmetrical, which should mean that your eyes are symmetrically seeing what's in front of you. There should be no deviation at all. Bear with me 1 second. Just need to go clear my throat. Apologies about that. Us doctors, they're working us to the bone. Even when we're not feeling well, we still need to come in and tend to you, our patients. Alright, I'm just going to feel around your face now, so just act normal. Relax for me. I'm just feeling for any lumps and bumps. Is this a new this right here? Do you feel that? Is that a new bump or something? Just underneath your chin there. Just let me have a little feel. Alright, I don't think that's anything to worry about. If that gets bigger, please call back our office. We'll be happy to look into it further, maybe send you for a biopsy or something. Good, good. My stethoscope nearly fell off my back there. Good. I'm just going to listen to your heart really quickly. First, I just want to listen to your breathing, so I'm just going to place this on your back here. Oh, excuse me. I'm just going to reach over you, and I'm just going to listen to the backside. Take a deep breath in for me, please. Follow along with my breath. Deep breath in. Now just let it out. Good. Again. Let it out. Deep breath in again. And out. Okay, let's look at that other side. Deep breath in. And let it out. Just follow along with my breaths. Deep breath in. And out. And the final deep breath in for me, thank you. And out. Any difficulties with your breathing there? No, good. I'm just going to get you to say the word 99 when I ask you to, okay? Right, just putting this on the front of your chest here. Okay, so 99 for me, please. Say 99. And 99. And 99. 99. Last one. 99. Good. Same thing, just follow. When I say it, you say it. Just putting this on your back. Say it again. 99. 99. 99. Do it again. And 99. 99. 99. Good. Just gonna listen to your heart. Just breathe normally for me. Follow along with my breathing. Good. Your heart sounds very healthy and your lungs are clear. That's what I was doing when I got you to say 99. I was just hearing how it sounds. It was like crackling or any of that type of stuff. Good, so we've gone through that stuff. Now I'm going to test your motor function skills with your neurological cranial nerves. So put your arms forward like this for me, please. When I pull backwards, you're going to resist. You're going to you're trying to sort of punch yourself in the face. So put your arm forward like that for me. I'm going to pull, and I'm going to say resist. You just keep resisting. 3, 2, 1. Resist, 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 resist. Great. Other arm. Put that arm, thank you. And resist, 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 resist. Good. Same thing. I'm going to get your arms like this. I'm going to push them towards you. So now you're trying to punch me in the face with the back of your wrist. So you're trying to push outwards. So put your wrist up like that. Good. And resist, 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 resist. Other arm. And resist, 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 resist. Oh. Any difficulties there? No. Your arms were pretty strong there, I would say, so that's good. Sorry, my tools just keep making a little bit of extra noise there while I'm trying to talk to you. That's good. Now, we're going to do this. We're going to get you to put your arms up like this. I'll give you an example. So, put your arm up like this for me, please. I don't care if you flex your bicep or not. I'll give you an example. You can flex yours like that. So, you're just going to push it up like this. That's all you're going to do. And then you're going to push down like that. I'm going to be testing as you push up. So, you're trying to push your fist up into the sky. Okay, ready? Alright. Now, and go. Resist, 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 resist. Other arm. Arm up for me, please. And resist, 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 resist. Excellent, excellent. I'm going to be pushing your arms up now. So instead of your arm needing to go up, I want you to try and resist me pushing it up. I'm going to be pushing up from your elbow, so you're pulling down, okay? Good. All right. And resist, 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 resist. Again. And resist, 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 resist. Any difficulties there? No, good. Just gonna feel down your neck here. Just looking for any lumps and bumps along your trachea, Adam's apple. This area, that region where your thyroid wraps around your throat here. Yeah, just looking for lumps and bumps. Can't miss those. What's this one right here? Oh, an ingrown hair. Okay, just wanted to make sure you know your body better than I do. Can you just say the words 99 for me as I place my hand there? Say 99. And again, say 99. And again, say 99. Great, I'm just going to have my hands around your neck here. I'd like for you to swallow for me. Go ahead and swallow. Go ahead and swallow. And go ahead and swallow. Good. Any difficulties with that? No. Good. I will check out the back side of your head very quickly here. No need to worry about it. I'm just feeling around the back of your neck. I'm not actually going to look. And the other side. Just feeling up the side of your neck here. And the other side. Good. Your neck feels fine. I'm just going to feel along here really quickly. Great. So far, I would say you're pretty healthy. Can you tell me your name? Good. Your date of birth? What day is it today? Who's the President of the United States? Good. Do you know which office you're in? Great. And what is my name? Excellent. So I'm happy with what you've demonstrated today. Again, we've gone through this many times, but you did a fantastic job. You always do. Shall we schedule you again in for a 3-month checkup? You're always welcome to come back sooner if you'd like. I won't hold that against you at all. Perfect. Margaret is just, you know where she is. A comment and a like is obviously all she expects. No payment necessary. I'll go write these notes down and I'll see you when you're in next. Take care. Bye. exam. This will be a lengthy exam today. I will be going through a variety of steps, many steps of testing your cranial nerves, making sure that not only are you fit to drive, fit to continue on doing your work, but just making sure that you are a healthy individual in general. I'll start by obviously being sanitary and putting on my gloves. You can't risk people getting sick in today's times, so wearing gloves is obviously a standard that some practitioners do not partake in. More of the old school, the old school generation, I'd say. So, shall we begin? I'll be doing a variety of tests to your eyes, to your ears, to your nose, your tongue, your lips, sections on your face, sections on the back of your head, feeling along your scalp, on your forehead, testing your shoulders, your arm strength, and your push strength in terms of your push and pull. First things first is testing your memory, but just also making sure I have the correct client in front of me. So could you start with your name, please? Great, thanks. And your age? Good. I know that you know these, and I can obviously see these characteristics and things on you, but it's just testing your memory at the same time. Your date of birth. The color of your eyes. Your weight. That's great. Any history of medical diseases in your family, past history? None? Okay. That's a good thing. It just means that, genetically, sometimes traits get passed along to us from our family members in previous lives, and that can just cause some concern. No history of any other types. Good. That's great. I'll be starting off with the first cranial nerve, looking at your eyes. Easiest thing to start with, to begin with. So if you could just be as still as you can for me, and I will just give you a variety of instructions for things to do. Just essentially at this moment, follow my instructions. Just do what I ask. If you could please look up into the ceiling for me. Just look up. Thank you. Good. Can you see the light when I'm shining it up into your eyes like that? Great. And how about when I shine the light up into your eyes? Right up there. Good. Any difficulties with that? Any double vision? How many fingers am I currently holding up? Great. Look down for me. vision there? Look down again. Any double vision there? Great, if you can just look that way for me. That's good. To the other side. Any double vision there? Excellent. Again, how many fingers? Good. Do you remember the first finger that I showed you on how many fingers that were? Great. I'm just going to be coming into your eyes with the light now from side to side, from the bottom and the top. I'm just looking at the dilation of your pupils to see if they're equal and reactive. Obviously, as you can see here, these are what I'm referring to in terms of how your eyes react to this. I'm going to be going in that eye first, so just look past me, look right past me, look at that photo for me. Good. That's great. Awesome job. Has your left eye always done that? It has. Good. I was just noticing it wasn't as reactive as your right eye. Your right eye would constrict and react to light almost instantaneously, where your left, it lagged a little bit. No worries though. Just gonna test that again. Test that other eye one more time. Good. Any double vision while I do that? You can still see me. Is there any light in your eyes right now? Good. Just look up for me one more time. I just want to look at something right there. I'm just going to pick your eye up here. Pick your eyelid up, I'm sorry. And then the other eye. I'm just going to pick that eyelid up again. Good, and just look down one more time. Okay, I'm not worried about that. I just wanted to make sure that the surrounding eye was in good health. Your pupils look great. The irises look great. The whites of your eyes, fantastic. Now I'm just going to stand back a bit. You just tell me if I get blurry or if I do not get blurry. So, can you still see me quite well? Good. How many fingers? What am I doing with my fingers? Good. When they were that close to your face, was it hard to see them, or did your eyes focus on my fingers? Great. How many fingers am I showing, and is this blurry or is this clear as I get closer? Blurry or clear as I get closer? It's blurry right now. Okay. Am I in focus? Good. That's alright. That's alright. It's nothing to worry about. Now I'm going to be coming in different angles. We're going to test your peripheral vision. So you won't know where I'm coming in. I'm just going to appear from corners of your eyes, the sides, the tops, etc. Just say yes when you see my fingers. Was that hard? Could you see them quite clearly, or was it you saw those lights come in. Good, alright. Any difficulties there? Good. Next, we're going to move on to your ears. This one won't be as intense. It's more just testing sections of your ears, just making sure that you can hear my voice equally in both ears. So I'm just going to have this. Now, does that sound equal in both ears at the same time? It does. Good. No issues there. I'm not really here to do a hearing test today, but as long as it's equal in both ears, that's all I'm worried about. I'll put this down. We won't need that again. Now, I'm going to do a little puff of air into your eyes and then just have a very quick look at them quite close up. So I'm just going to clean off the sections of your eyes here. Just, could you close your eyes for me, please? Thank you, thank you. Alright, I'm just going to get very close to your eyes. I just need to check your retina, but on the back side of your eye where it attaches. So just getting extremely close. I do apologize. Test out this side. Good. No issues there. Won't be needing that again. Just gonna write some notes. Just keep yourself busy for a second. I'm just gonna. Just writing about your left eye, how it was slow to react. Good. Alright, so we've done your eyes. I've done your ears. We're going to do a little bit of a smelling test. Excuse me, a little frog in my throat there. I'm just going to wave this. Where is that? There we are. Just going to wave this in front of you. Just tell me, what does that smell like? Just underneath your nose there, what's that smell like? You're correct. And this? What does that smell like? And this? What does that smell like? Good, 3 for 3. Every person has sort of a unique way of what they smell, but yours was spot on. No issues there. So your hearing is good. Your smell, good. Your eyes, fantastic. I'm just going to have a reach around the back of your head here. Just feeling along your neck. Just any lumps and bumps quickly. Along the top of your head. What's this piece right here? That piece right there. That's okay. It was just a little bit of your hair was matted. You must have not had a shower today and just came with your bed head. That's fine. It's a doctor's office. You're not here to impress me. I'm here to impress you with my practitioner skills. Good. Just get a little feel around your face. I'm just looking again for any lumps and bumps on your face. Anything that seems sort of out of the ordinary. Now this spot right here. That one. Is that new? No. Okay. What that is hyperpigmentation. It just means you've been out in the sun a little too much in that specific spot on your face. I've actually got one right here. Sorry, that piece right there. It just means the sun has gotten a little too much on your face, and it doesn't mean anything bad. It's not the C word at all. It just means too much melanin was essentially dealt with in that moment, and because of the sun and its UVs, it's just sort of discolored your skin. Nothing to worry about. There are treatments out there that can fix that. Okay. Just having a gander at the rest of your face. Great. Now we're going to get on to a push-pull section where I am going to take your arm like so, and you're going to resist as I pull it and push it away from you. I'll be doing the same thing with your shoulders. As I push down on your shoulders, you will be pushing up. I will then go under your elbows, and I will be pushing up as you are pushing down. Just testing more of, you guessed it, your cranial nerves. So let's dive into that. Great. So, one thing I didn't do, I know there's a lot of nerves in your eyes that connect with your cranial nerves. I didn't test your vision in regards to closing each eye individually, so I do apologize. So, I'm going to have you cover your eye. Let's cover that eye. Great. Can you still see me? Great. Was it harder to see me? Easier to see me? You decide and let me know. Good. And let's cover that eye. How's that? Any easier to see me? Can you still see me? Great. Let's cover your entire both eyes. Can you still see any peripheral light around your eyes? As I move it around your eyelid, can you see light entering in different shades and areas? Great. No need to worry there. We're done with that. I just needed to finish that portion off. And then the last part, actually, I just need to check the symmetry of your retinas in relation to your nose to make sure that what you're seeing is, in fact, straight-eyed seeing. So just stay there for a second, please. Let's see. Just stay there. I'm going to get nice and close and look at your distance apart. Excellent. That's the one measurement. I won't need those anymore. Let's write a little bit of these notes in so that I can dictate your findings later. I'm just going to write down about your ears, the hearing, a little bit of your eyes there, and then your sense of smell. Good. Just wanted to know that your smell was superb. Now I got a little bit of that nose there. Sorry from what I had you smelling those things, so let's just clear that off. Try to hold that sneeze in. Good. Let's just look up. That's good. Cleaned all that off. I do have a pair of scissors. I just need to. While it's okay to have nose hairs, totally fine. These are surgical grade scissors. An abundance of them, too many of them, can cause congestion, so I'm just gonna clip a couple of the nose hairs just off around the center there. Just perfect. That's great, that's great. How you feeling? How you doing? You doing good still? Do you need a break? I know it's a lengthy exam, but I want to make sure that I'm thorough with it. Before we get onto the push and pull section, I'm going to listen to your heart. Obviously, it's not one of your cranial nerves, but it is crucial in terms of keeping those cranial nerves active with blood flow. So, I'd like for you to just be calm, breathe normally. Good, good. Sorry, I know it's a little cold. Okay, take a deep breath in for me right now. Good, good. One more deep breath. Let's check the other side. May as well check your lungs while I'm here. Okay. That's alright. I'm going to put this on the back side of on your back, and I'd like for you to repeat the words 99 to me, okay? Go ahead, say the words 99. Good. And again. And again. And again. Good. We'll do the lower lobes. The lower lobes. Go ahead. And again. Great. And again. Just going to go back up to that top section. One more time. And again. And again. Good. Your heart's totally fine. I won't be needing this again, just doing that one test. Getting down to the final bits of tools that I have left where I'm going to be examining your eyes. Won't be needing that either. Or that. Once I run out of tools, that means the test is done. Now we're going to move on to your cranial nerves, like I said, where you push and pull. Push and pull. So the first thing I'd like you to do is put your arms up one at a time like this, just a single one. You can pick whichever one. Good choice, good choice. I'm going to put my hand on that and I'm going to pull towards me, okay? Alright, so here we go. Hand there, and resist, resist, resist. Keep going. Excellent. Was that hard at all to resist me pulling? Obviously, I'm not going to pull with all my strength, but I want just enough where I can see your nerves and muscles working in conjunction with each other. Good. Now, let's do this one here. And ready, and pull, pull. Sorry, I'm pulling. You resist, resist, resist. Was that hard? No, that I did not toot. That was the gloves. They made a little weird noise. I would never do that in front of my patients. Good. Now I'm going to be doing the same thing, but with both hands, and I'm going to be pulling at the same time. So, both arms up like this for me, please. Thank you. And resist, 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 resist. Great job. We're going to do that same sequence, except I'm going to be pushing, pushing, and then pushing. We'll start with the same arm as last time, okay? I'm going to push towards you. I want you to push. Sorry, I'm going to push towards you. I want you to push away from me. Okay, ready? Here we go. Resist. 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 There's that noise again. Resist. See, as you can tell, I would never do that in front of my patients. Next time, you gotta have some humor when you're being a doctor. And resist. 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 How was that? Was that hard? It was. Harder than normal. Like, I found that when I was pushing, this arm was sort of letting it go a little bit faster than this one. Do you work out? You don't. I'm suggesting that you incorporate health fitness activities into your regime somewhere along the line. Studies have shown that if you incorporate exercise into your life, statistics show you will live longer and healthier with less complications in your skeletal muscle, your skeletal or muscles in general. Good. I'm going to be pushing down on your shoulders now, so just get as comfortable as you can. I'm going to push down like that. So here we go. And 3, 2, 1. Resist, 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 resist. How was that? Was that hard or easy? Good. Now I'm going to be pushing up on your elbows, so just arms by your side. Create a 90-degree with your elbow like you're holding up a board. I'm going to push up on your elbows. I'd like for you to push down with your shoulders. Don't let me push your shoulders up. Alright, here we go. And resist, 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 resist. Good. I'm not going to push too hard. That was excellent. You did a great job there. How did that feel for you? Not too hard. That's good, that's good. Let's write that down. Okay, so we've pretty much come to the conclusion of our test. Let's just clean off that. Sorry, there's a little bit of that smelling powder on your face. There we go. Now, do you have any questions for me? Other than our next session, 3 to 6 month timeline to retest those cranial nerves, as I now have a baseline of what I'd like to do for you, how I'd like to go forward using those incremental levels. I'm just having a look into your ears really quickly. I did a little test for the hearing, but let's just see how healthy the inside of your ears are. That's good. And then this side. Great. I'm happy. I hope you're happy. Obviously, if you've had a good session today, Margaret's just outside the door, and as always, you know she doesn't take payments from you. No. She just appreciates a comment and a like, and if you can subscribe to her newsletter, she would be so appreciative of subscribing so that she can book you in for your next appointment. So, I'll see you at the next one.